The majority of us will develop some degree of plaque in our arteries, what we call atherosclerosis over time, but not all of us will die of heart disease. Hi, my name is Dr. Navarro. I have been caring for patients for over 25 years. By the time people develop heart disease, meaning a blockage severe enough to cause chest pain or a heart attack, the process has already been quietly running for 10, 20, even 30 years. This isn't something that suddenly starts in your 50s. Heart streaks in arteries have been found in teenagers. What matters most is what you do decades before any symptoms appear. Here's how you keep your arteries as clean as possible for as long as possible. Number 1. Protect the endothelium. Atherosclerosis begins with damage to the endothelium, the thin inner lining of blood vessels. Once that lining gets irritated, LDL particles sneak underneath, immune cells show up, inflammation starts, and plaque slowly forms over years. Top things that damage the endothelium are blood sugar spikes, even if you're not a diabetic, smoking or vaping, high blood pressure, chronic sleep deprivation, air pollution, and diets high in ultra-processed foods. Number 2, keep your cholesterol low, and more specifically, your ApoB lipoprotein. Most people are told to watch their LDL-C, but the real drivers of atherosclerosis are ApoB particles, as they can penetrate the arterial wall. Please watch my 2 previous videos on lipids and atherosclerosis. Your lifetime exposure to ApoB lipoproteins is one of the most significant risk factors for developing arterial plaque. Ways to lower ApoB lipoproteins are limit saturated fats from fatty red meat, butter, coconut oil, processed meats, and replace them with olive oil, nuts, fatty fish, avocado. Eat 30 to 40 grams of fiber, especially soluble fat, like oats, beans, and lentils. Maintain a healthy waist circumference. Number 3 is physical activity. Exercise does several things against atherosclerosis. Improves endothelial function, raises nitric oxide, makes LDL less likely to oxidize, and improves insulin sensitivity. The best combo for artery health is 150 to 300 minutes a week of zone 2 cardio, and 2 to 3 times a week resistance training. Number 4 is sleep. Inappropriate sleep raises in blood pressure, worsens insulin resistance, increases inflammatory cytokines, and elevates cortisol. All bad for blood vessel health. Aim for 7 to 8 hours at night of consistent schedules. Sleep apnea, even mild, is strongly linked with early atherosclerosis. Worth screening if you snore or feel unrested or unrefreshed in the morning. Number 5, avoid at all costs or catch early and address diabetes, hypertension, and metabolic state. Watch for early markers of these conditions, including fasting insulin, triglycerides, high sensitivity CRP, ApoB lipoproteins, and hemoglobin A1c. Don't look at these numbers only as normal or abnormal. Look at the trend over time. These values often drift for years before the doctor calls them a problem. Number 6, zero tobacco exposure. No safe amount. Even occasional smoking impairs nitric oxide, increases LDL oxidation, and accelerates plaque formation. Secondhand exposure counts as well. Number 7, manage chronic stress. Most of us live constantly in fight or flight mode, resulting in long-term sympathetic activation, which increases vascular inflammation, stiffens arteries, and worsens lipid metabolism. Consider aerobic exercise, time outdoors, social connection, meditation, and mindfulness. Bottom line, atherosclerosis is cumulative arterial wall injury over time. The earlier you put in practice all we have discussed above, the less plaque you will ever fall. My name is Dr. Navarro, and you're watching my channel, Vibrant Health and Longevity. Until next time, stay radiant, stay strong, and keep on thriving.